I'm Dr. Clay Beshore, and I'm going to talk a little bit about care of your mouth following an extraction and possibly a bone graft. So we often use PRF when we extract teeth, but if for some reason you have not had PRF used, then the first concern is bleeding after a surgical procedure, and so it'll be necessary for you to keep gauze and good solid pressure on the surgical site until the bleeding stops. If for any reason the bleeding hasn't stopped after 3 to 4 hours or it's excessive, please contact the office. Immediately following any type of surgical procedure, specifically tooth extraction, you're going to have to expect some level of discomfort and some swelling. If you want to try to reduce the amount of swelling, then you can place ice on the surgical side, on that side of your face, 15 minutes on and 15 minutes off. If you don't want to use ice, you can use frozen vegetables. Take a pack out of the freezer and put it on your face for 15 minutes and throw it back in and get a different one out next time. But that will help reduce the amount of swelling that you might have if you do that for the first 24 hours. You also should expect the possibility of a little bruising as well. Should reduce your strenuous activity for the first 24 hours. We want you to drink plenty of fluids and try to limit your diet to softer foods for the first 2 to 3 days following surgery. And be sure that not to start doing anything that requires much chewing or drink any hot liquids while you're still numb, because you can cause some damage to the numb areas because you can't feel it. If you smoke, ideally it'd be best for you not to smoke for 24 hours. One important factor when you've had a tooth extracted and a bone graft done is to try to avoid rubbing your tongue over the area. When you have a tooth removed, it feels really strange to have that space in your mouth, and subconsciously your tongue wants to go over there and go back and forth across that surgical site. It's real important to avoid doing that because the tongue can loosen up the sutures that are placed and cause the PRF to become dislodged, or the membrane that's holding our graft material in place. And so it's very, very important. Your tongue is probably the greatest detriment to success of our procedure. We want you to brush and floss as normal, just taking care to keep your toothbrush away from the surgical site. If you use a water pick or an electric toothbrush, it's fine to use it in the other areas of your mouth. Just try to avoid having those come in contact with the surgical site. The day after the surgery, when we've done a bone graft, we would like you to begin rinsing with the chlorhexidine that we've prescribed for you, along with taking an anti-inflammatory, which we'll have also prescribed. From a pain medication standpoint, most often we're going to prescribe you a non-narcotic regimen of taking Tylenol and ibuprofen or Advil. And that regimen would be 1 Tylenol, which is a 500 milligram, which is acetaminophen, and also 2 ibuprofen or Advil every 4 hours. And this is equivalent to a mild narcotic without all the side effects. If for some reason you are prescribed a narcotic, then we want you to take that as directed. You can also take ibuprofen with the narcotic, which we would recommend because of its anti-inflammatory benefits. But because the narcotic includes Tylenol or acetaminophen with it, do not take Tylenol along with the narcotic. And if anything develops that you have questions or concerns about how your healing is progressing, you have unusual levels of pain or bleeding, please contact our office.